Hello, my name's Dr. Ron Daniels. I'm an intensive care doctor, but I'm also the founder and chief executive of the UK Sepsis Trust. So we're here on a farm in the glorious sunshine to talk about sepsis and how it pertains to those in the farming community. And this has been made possible by the generosity of the NFU Mutual Charitable Trust. So what is sepsis? Well, sepsis used to be called blood poisoning or septicemia. It's the way the body responds to an infection. We have to talk about the real reason NFU Mutual have taken such an interest in sepsis and are really driving awareness. And that's about a young woman called Hannah Brown. Hannah was just 26 when she died. She left behind her fiancé Ben, her daughter Millie, and their parents who were working together to build a legacy for Hannah. Hannah didn't need to die. She knew she was unwell, and that's why it's critically important that we work with the farming community to remind them that they need to be aware of the risks of sepsis. So I'm here today to talk with Hannah Binns, who's a farming specialist at NFU Mutual.
Growing up on a family farm, I know from first-hand experience that there are a number of ways farmers can cut themselves, from catching themselves on barbed wire or metal burrs to using handheld tools.
The reality is that minor injuries and skin infections cause about 10% of episodes of sepsis, and among farmers it's going to be much bigger than 10%. It's really important that they keep them clean, that they keep them dry, and that they know that if they have suffered minor injuries, that they need to be aware of the risk of infection.
And the very nature of farming means that they're outside in all weather conditions, so more likely to fall, especially in farmyards which are wet, slippy, and I guess that can play a role in sepsis.
If someone's suffered a fall, and even if it's as simple as it's a sore leg and they're laid up or they're less active than normal for a few days, then that can bring about other risk factors for sepsis, such as urinary infections, such as chest infections and pneumonia. So again, it's important that farmers are aware that after any injury, whether it's a break in the skin or not, they need to be on the lookout for symptoms of infection and to act quickly if they're worried.
Farmers drive agricultural machinery and vehicle on a daily basis, but at certain times of the year, other equipment comes out of the shed. But with bigger kit comes bigger risk, is that right, Ron?
It's not just about cuts and grazes. Crush injuries can be equally worrying. For example, if you have a crush injury to the thigh, you can get a swelling of blood inside the thigh. There's no damage to the skin, but the blood collects underneath, and that is a sitting duck for infection to develop.
As well as machinery, farmers will often vaccinate their livestock, sometimes using needles.
When we take a needle from one animal to another animal and then we accidentally get a needle stick injury, we're carrying not only the drug that we were intending to give to that next animal, but we're also carrying blood, bacteria, hair or fur from the previous animal.
And what about single-use needles? There might be a temptation to use those more than once.
What we don't want to do is to see needles that are intended for single use used for multiple procedures, because then they carry exactly the same risks as a multi-use needle. And if you're at all worried, again, ask that question, could it be sepsis?
Well, as we all know, farmers are fantastic at looking after the welfare of their stock or their crop, but less so with their health, and they have a tendency just to crack on, it'll all be okay. But it's so important that they seek help if symptoms progress or they start to feel unwell.
Sepsis is a medical emergency. For every hour we delay getting the right treatment into the patient with sepsis, the chance of surviving reduces by 1 or 2%. And that's a message that I really want to hammer home to farmers. There are two key take-home messages here. Firstly, if you or someone you care about is not quite right with an infection, then go to 111 or go to see your GP and just ask, could it be sepsis? Second, if you've never seen this person this unwell before, if you're worried that they're critically unwell, there are 6 key symptoms to look for, and they spell the word sepsis. S for slurred speech or confusion. E for extreme pain in the muscles or joints. P for passing no urine, no water in a day. S for severe breathlessness. I for it feels like I'm going to die, and people really do say that. and the final S for skin that's mottled, discoloured or very pale. Any one of those 6 symptoms in the context of infection, it's go straight to A&E. This is a medical emergency.
At NFU Mutual, we'd like to say a big thank you to Hannah's family for their incredible work raising awareness of sepsis within the farming community. Hannah's legacy is already making such a difference.
And I'd echo that. I'd like to offer our sincere thanks from the UK Sepsis Trust to NFU Mutual Charitable Trust and to Hannah for her expertise in bringing this together. If you're worried about someone with sepsis, or if you've been affected by sepsis, or if you just want to know more, please visit our website at sepsistrust.org. There you will find everything you need to equip you to save lives. Thank you.
Thank you.